Senate confirmation for a key healthcare post remains in limbo. The CDC loses another one of its top leaders. And the president delivers the State of the Union address. For the week of March 2nd, 2026. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Of Congress and my fellow Americans, our nation is back, bigger, better, richer, and stronger than ever before.
Kicking off this week's episode with news from Capitol Hill, where President Donald Trump delivered his State of the Union address on Tuesday. While healthcare issues were not a primary focus of the record-length speech, the president highlighted his administration's efforts on eliminating healthcare fraud and improving affordability. He reiterated his desire for direct payments to Americans for purchase of health insurance coverage and called on Congress to codify his most favored nation proposal to link domestic pharmaceutical prices to lower prices available in other countries. President Trump also discussed efforts to target Medicaid fraud in Democratic states like Minnesota and called for further restrictions on gender-affirming care for youths. Virginia Governor Abigail Spanberger gave the Democratic rebuttal and spoke about the impact of Republicans' One Big Beautiful Bill Act, particularly on the Medicaid program and rural health care providers.
Of this chair, and I think the view of my down dais members, that our job as legislators is to legislate, which is why we were elected. And as chair, I want us all to work together to pass legislation that makes the life of an American citizen better.
That was Senator Bill Cassidy, a Republican physician from Louisiana and chair of the Senate Health, Education, Labor, and Pensions Committee, who last week advanced two healthcare-related bills. The Living Donor Protection Act would prohibit life insurance, disability insurance, and long-term care insurance carriers from denying or otherwise restricting coverage for living organ donors. It would also qualify donors for 12 weeks of medical leave. The Healthcare Cybersecurity and Resiliency Act would provide grants to health entities to improve cyber attack prevention and response, and require the U.S. Department of Health and Human Services to develop a cybersecurity incident response plan. Each bill was approved in a 22-1 vote, with Senator Rand Paul, a Republican physician from Kentucky, voting in opposition. More from the Senate, where Senators Roger Marshall, a Republican physician from Kansas, and Cory Booker, a Democrat from New Jersey, have sent a letter to the Center for Medicare and Medicaid Innovation recommending the development of a model to evaluate the impact of medically tailored meals for Medicare beneficiaries with acute and chronic diet-related illness. The letter reads, quote, Congress established CMMI to test innovative payment and service delivery models that improve care quality while reducing expenditures for the Medicare and Medicaid programs. Medically tailored meals are an ideal candidate therapy for achieving this mission, unquote. The letter highlights evidence that medically tailored meals can reduce hospital stays, improve health outcomes, and lower overall healthcare costs in Medicaid and other payer settings.
Better? Yeah. Just too far away. Sorry about that. Sticking with vaccines, you have stated that there is, quote, growing evidence that the total burden of the current extreme and growing vaccine schedule is causing health declines in vulnerable children. And so I've heard your comments to several of my colleagues here today, so I want to drill down more specifically.
Surgeon General nominee Casey Means appeared before the Senate Help Committee for a confirmation hearing on Wednesday. Lawmakers on both sides of the aisle questioned the nominee about her position on vaccines. Means repeatedly stated that, quote, vaccines save lives, unquote, while also underscoring the importance of a true informed consent process between an individual and their healthcare provider. Means still lacks the votes needed to advance her nomination, with Senator Susan Collins, a Republican from Maine, and Lisa Murkowski, a Republican from Alaska who you heard at the top, remaining undecided on how they'll vote.
The opportunity to testify today. While the moment certainly feels familiar, the issues before us remain critically important. Let me start with a simple reminder. Legislating is challenging by design. The path here may have been different than expected, but our responsibility is the same, to fund the government and keep it working.
The House Appropriations Committee has released guidance for fiscal year 2027 programmatic, language, and community project funding requests. Members of Congress have until March 13th to submit requests for Agriculture, Rural Development, Food and Drug Administration Subcommittee, and March 20th to submit requests for the Labor, Health and Human Services and Education Subcommittee. Lawmakers will be allowed to request funding for up to 20 projects, an increase to the current limit of 15, with Labor, Health and Human Services project funding limited to the Health Resources and Services Administration account.
According to CMS, America spent $5.3 trillion on healthcare in 2024. That represents a staggering 18% of our country's gross domestic product. Over
the House
200
Energy
million
and
people
Commerce
in the
Committee will
US get their
reportedly
health
hear from
insurance
healthcare providers and hospitals during the panel's next hearing in its series on affordability. The committee has already received testimony from health insurance CEOs and representatives of the groups along the pharmaceutical supply chain. Chairman Brett Guthrie, a Republican from Kentucky who you just heard, recently told reporters that the details of the next hearing are still being determined. In more news, the Congressional Budget Office has released an updated projection of the Medicare Hospital Insurance Trust Fund's solvency over the next 25 years. CBO estimates that the fund will be exhausted in 2040, 12 years earlier than previously anticipated. The agency attributes the earlier insolvency date largely to changes put in place by the 2025 reconciliation bill, which lowered tax rates and created a temporary deduction for taxpayers aged 65 or older, thereby reducing total revenues from the taxation of Social Security benefits. Increased demand for Medicare Part A services was also a factor in the updated projection. If the balance of the fund were to be exhausted, Medicare would need to reduce total benefits by 8% in 2040 and up to 10% in 2056.
I recommend vaccines all the time, just not all the vaccines for every person. Everybody's different. Everybody has different health.
Final news today, where Centers for Disease Control and Prevention Principal Deputy Director Ralph Abraham, a physician, has departed the agency, citing, quote, unforeseen family obligations, unquote, which local press reported was due to the, quote, failing health of a close relative in his 80s, unquote. Dr. Abraham, the former Surgeon General of Louisiana, assumed his post as the second highest-ranking CDC official less than 2 months ago. His announcement follows other recent health personnel changes in the administration, including the naming of National Institutes of Health Director Dr. Jay Bhattacharya as acting CDC Director on February 18th. The CDC has been without a permanent director since the firing of Susan Menarez in August of 2025.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first HELP Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, March 3rd at 10:15 a.m., the Senate Commerce Subcommittee on Science, Manufacturing, and Competitiveness holds a hearing titled Less Hype, More Help, AI that Improves Safety, Productivity, and Care. Second, on Wednesday, March 4th at 10 a.m., the Senate Environment and Public Works Committee hosts a hearing to examine a discussion draft of the Toxic Substances Control Act Fee Reauthorization and Improvement Act. Third, on Wednesday, March 4th at 2:15 p.m., the House Veterans Affairs Subcommittee on Oversight and Investigations gavels in an oversight hearing titled Delivering for Veterans and Caregivers, Year 1 of the Dole Act. Fourth, on Thursday, March 5th at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, convenes a hearing entitled Transforming Healthcare with Data, Improving Patient Outcomes Through Next Generation Care. Fifth, on Thursday, March 5th at 10:15 a.m., the House Veterans Affairs Subcommittee on Health holds an oversight hearing titled Hidden Wounds, Effectively Supporting Veterans with Traumatic Brain Injury. And last, on Thursday, March 5th at 10:30 a.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies hosts a Member Day hearing. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.